All right, so this week we'll be covering mindfulness based therapeutic modalities and addiction recovery. Some of the topics we'll be discussing are definitions of mindfulness, um, therapeutic modalities, and interventions of the orientation. We'll look a little bit more in depth at mindfulness oriented recovery enhancement. We'll also cover the sequence of more within group sessions, some of the outcomes of treatment based on the empirical literature, specifically looking at Moore's efficacy when used with treating alcohol use disorder, and in another study, pain and opioid dependence. There's also a slide of the media that was added to the module this week. There are 3 videos, 2 with specific interventions that are used, and 1 that more thoroughly describes mindfulness oriented recovery enhancement, otherwise known as MORE. Also added some unresolved issues in the literature related to mindfulness, uh, some of the mindfulness interventions, and just the topic in general as it relates to addiction treatment. Finally, I added some of the discussion questions. We'll briefly conclude, and if you would like a list of the references, they are added to this presentation. So, definitions of mindfulness. Brown and Ryan define mindfulness as an open and receptive attention to and awareness of what is occurring in the present moment. Shapiro defines it as an awareness that arises through intentionally attending in an open, accepting, and discerning way to whatever is arising in the present moment. Jaha, Krompinger, and Baim, please correct me if I'm mispronouncing those. I think that I probably am. An attention that is receptive to the whole field of awareness and remains in an open state so that it can be directed to currently experienced sensations, thoughts, emotions, and memories. Siegel states that mindfulness is like waking up from a life lived on automatic pilot and based in habitual responding. That's less of a definition, more of a perspective on mindfulness. I added a little statement at the bottom here that just identifies common themes within all of these. One is really just a general receptivity of the here and now experience and a full non judgmental awareness of the present moment. You can see that there is no one definition of mindfulness. This is somewhat unique, and uh, mindfulness has yet to be operationally defined. I'm sorry if you hear my coffee maker going off in the background, that's a bit annoying. So back to the presentation, you'll notice that mindfulness has no real operational definition yet, and different researchers refer to it differently, and so that is one of the issues within research um, as it relates to mindfulness and mindfulness-based interventions. So some of the therapeutic modalities, mindfulness-based cognitive therapy and mindfulness-based stress reduction, these are probably some of the 2 most research orientations related to mindfulness. mindfulness-oriented recovery enhancement, otherwise known as MORE. We'll be spending more time, no pun intended, we'll be spending more time going over this orientation specifically. The video for this week is related to this form of mindfulness treatment, and I think why I chose to go this route is intended for recovery. It's intended to be used within substance abuse and addiction fields. Some specific mindfulness interventions. Kahana and Greason found that yoga was effective for addiction treatment. Their study was done within a residential addiction treatment facility, and there were beneficial findings from the use of yoga, guided meditation, as well as mindfulness group techniques to address crave surfing, or I think more formally referred to as urge surfing. So MORE, when used for targeting pain and prescription opioid use, that is the video, and here you'll see I think your second discussion question, which is, after watching the mindfulness-oriented recovery enhancement video, what is a way that MORE can be used to test hedonic dysregulation? Now, hedonic dysregulation is a process that occurs in the brain where essentially the person is experiencing distressing affect or distressing emotion, and so their brain is experiencing this form of dysregulation that's, I think the best way to describe it is going down the old pathway of using, and opposed to using, the person would identify this craving or urge and then urge surf. They may do other things like cognitive reappraisal, or engage in the here and now and savor the moment. MORE is considered an integrative treatment for hedonic dysregulation, and it is specifically designed to unite mindfulness, savoring, and reappraisal. Here I say reappraisal. In other charts you'll see cognitive reappraisal. They mean the same thing. This chart is also posted within the video, the Garland video, and it basically breaks down the various theoretical components or intervention components of MORE, as in mindfulness training, cognitive reappraisal, savoring, as well as it goes further into the mechanisms and targets of treatment. Now, one of the things that is unique about MORE is it's designed specifically for group sessions, and it is considered a sequential treatment modality. And so in the chart, you'll see down arrows on the far left and far right. That indicates a top-down approach, and then from left to right. Garland explains this chart more in depth in the video, and I highly suggest that you watch the video and learn more about it. So some of the outcomes of treatment, so in this presentation I've added 2 experimental studies. This first one, one experimental study and one qualitative study. This first study is where 18 participants were interviewed. 18 participants were interviewed who also experienced alcohol dependence within a residential treatment community. And as the more intervention was conducted, that the participants' narratives were transcribed or recorded, and then the responses were analyzed. The findings showed that more enhanced self-awareness while helping clients to cope more effectively with emotional distress and addictive impulses. Now, this is kind of interesting because some of the literature on self-awareness and emotional intelligence, for that matter, would substantiate this, in that understanding what is happening with oneself in the here and now, both emotionally and even physiologically. They mention addictive impulses, and I think those impulses are physiological reactions to the emotional distress. This is also a good the end of that last point is a good way to also think of hedonic dysregulation. If you're interested more about that, maybe look it up. There's quite a few areas of the brain that are involved in that. So some more outcomes of treatment. In 2017, Garland and colleagues conducted another study. This one was experimental. And what they did was, excuse me. And what they did was they assessed what's called pain and positive affect using ecological momentary assessment, which is considered an experience sampling method, and is recorded. So data is recorded as the person experiences an urge to use, or an emotion of pain and positive affect in this case. The researchers used secondary data analysis from more group participants and in a support group. They had both groups track EMA data, or ecological momentary assessment data. The support group in the literature is defined as 12-step groups. Participants in the MORE group reported significant improvements in momentary pain and positive affect than patients in the support group. Participants in the MORE group were also more likely to exhibit positive affect regulation than patients in the support group. This means that even when they felt good, they were able to regulate. They were also able to regulate even negative experiences with positive affect. Improvements in positive affect, but not pain, over the course of the intervention were associated with reduced risk of misusing opioids by post-treatment. Now that's a really interesting point, because it demonstrates that through positive affect alone, they were able to reduce the risk of misusing opioids. it doesn't say that they were still in pain. Clients might have still been in pain. However, they were able to use positive affect and reduce their risk of misusing opiates. It just goes to show you how powerful the mind is and the resilience that these clients were able to demonstrate. Granted that the research was conducted ethically, which we'll go ahead and assume that in this case it has been. We'll give them the benefit of the doubt. The last point here is that researchers concluded that more may be useful in non-pharmacological treatment for pain and hedonic deficits among chronic pain patients at risk for opioid misuse. Now, this is interesting because many of the clients who are opioid dependent or have even experienced very real pain and for whatever reason have advanced in their use to heroin or fentanyl, this recommendation of implementing the more treatment model could help with, could be useful with non-pharmacological treatments. So if those clients have gotten to a point to where maybe even gabapentin or Vistaril is no longer an option for them, if they really, maybe just want to live with more pain, if they can tolerate it, then this treatment modality would certainly be an option. So the three media videos that are added to the module this week are mindfulness-oriented recovery enhancement, targeting pain and prescription opioid use. That was published by Our Amazing World. The second two are actual short videos. I don't think they're over 3 minutes a piece, and they're examples of Devin Ashwood conducting empirically based mindfulness-based relapse prevention interventions. In the first intervention, I think he uses a guided meditation. In the second, he's within a group session and uses a mindfulness and what seems like a cognitive reappraisal intervention to induce urge surfing, and then work with clients to mindfully process that experience. One might even call that savor that experience. Anyway, the point was to provide examples of interventions that where you could be applying mindfulness-based interventions in your work with clients. So some of the unresolved issues, the first being the operational definitions of mindfulness. There are multiple, even operational definitions. I think earlier I said there's no one operational definition. And I think that's still the case. We still also don't know the target areas of mindfulness-based interventions. Now, the research that I'm reporting here was conducted in 2014, so some of these things could have been found out and resolved at this point. The third point is mechanisms of change following mindfulness-based interventions. And then dissemination and implementation struggles. There have still been struggles with implementing interventions and modalities of mindfulness. Interestingly, I think with point 2 and 3, more seems to hit at both of these. So this part of the unresolved issue could begin to be resolved. Um, Also, the fourth point with implementation struggles, more is very specific that it's intended for groups, and that could also be an indicator of if you're intending to use more within your treatment, that it's done most efficaciously within a group setting. So these are your discussion questions for the week. If you want to go to the weekly discussion panel, you can go ahead and answer those. Just tie a couple things together here. I would like to know what your definition of mindfulness is. How do you describe it? After watching the mindfulness-oriented recovery enhancement video, what is a way that more can be used to test hedonic dysregulation? And in what ways is the urge surfing intervention from the second video connected to mindfulness orientation recovery enhancement? If you have any questions about these, please just shoot me or Dr. Richardson an email. So in conclusion, we presented some definitions of mindfulness, some of the current therapeutic modalities, mindfulness-based relapse prevention, mindfulness-based stress reduction. I think there was also mindfulness in cognitive therapy, and of course more. More was presented as an emerging counseling modality that could enhance clients' mindfulness, reappraisal, and savoring. It was also specific to being used within a group setting. The treatment outcomes: self-awareness while helping clients to cope more effectively with emotional distress and addictive impulse. And more is also being found to be useful for non-pharmacological treatment for pain and hedonic deficits among chronic pain patients at risk for opioid misuse. And then 5, provided the media outlets for you to watch and enjoy this week. So thank you very much. The last page here are the references if you're interested in looking at those or reading more in depth about more mindfulness. You are more than welcome to have access to these references. Thank you all. Make it a great week.